Americans panicked over a possible Ebola outbreak.
Ebola.
As you know, this Ebola strain...
Ebola outbreak. Growing fears about Ebola.
Tested for Ebola.
Growing Ebola fear spreads around the country.
There are fears the outbreak will continue to spread.
Spreading much faster than efforts to contain it.
Spiraling out of control.
Stop admitting West Africans into America right now.
A big outbreak of the deadly Ebola virus in West Africa has killed more than 670 people and is now taking a toll on healthcare workers on the front lines.
So they should be sending people who are retired, who have no children at home, people like me.
When I agreed to take this assignment, I was quite frightening, and I gave it quite a bit of thought. You know, I have a family, I have three young children. Am I placing myself in danger by going over there? But I think the real answer for me was no. This is what I do.
It was the right time in my life. I felt it important to be on the right side of history. This is the world's largest outbreak of Ebola, and I wanted to do something directly to improve conditions there.
I was actually on the first day of vacation in a remote area in Oklahoma, and one of my techie friends comes outside and he goes, "Patty, there's a case of Ebola in Dallas, and they've opened the incident command center." And I looked at him and I said, "Greg, if you are messing with me, there's going to be problems."
Information was evolving as the outbreak happened, and because it was a serious disease, there was a higher level of concern than we would normally see with other diseases.
So with like flu, you get the flu and people kind of poo-poo flu. And flu is a big deal. It kills a lot of people, but it doesn't usually kill healthcare workers. It usually kills the very young and the very old. So, you know, with Ebola, it was like leveled the playing field.
I knew that the Ebola was bigger than anything I'd ever seen.
I received hundreds of emails each day. My pager, my cell phone was going off.
We were just working around the clock, trying to get night shift trained, day shift, running drill.
I got calls from people like, this person had been in like Bali, and I'm like, that's the South Pacific, that is not Africa.
So we had 3 people walk in off the street into the lobby, thank you very much, not even through the ER, saying, "I have Ebola." Oh yeah, it was a wild time.
I was actually hospitalized with dehydration during that time. I was pregnant and got hospitalized because you didn't have time to eat, drink, you didn't have time to do anything.
We trained over 770 healthcare workers going to West Africa.
An APIC consulting called and said, "We are developing an APIC video with the CDC and Johns Hopkins, and we'd like you to come up and help."
There was a need to train people that were Spanish speakers that were joining the Ebola response. And I was sent to Guinea to train a specific group of people that only spoke Spanish.
During the week that I was there in training, there were 2 fires in the ETU. And I said, our facility is going to have a fire plan.
I was in Sierra Leone as an infection prevention and control specialist. It was very, very hot. There was no electricity, there was no running water, and the patients were housed in basically tents. I walked into the tent and there were rows and rows of cholera beds. The patients that I saw that were very clearly ill and probably would not survive Ebola were huddled on the ground. They were lying on the ground. They were covered in body fluids and they were moaning. I mean, as I said, nothing can prepare you for that.
You know, I think the first time that you have a potentially infectious fluid on you, blood or fecal material or vomit, it's a real eye-opener. And so a lot of time moms are already sick or in the confirmed unit. So the babies and children under 8 or 9 are left by themselves. And one day I was doing infection prevention round in between the 2 shifts of clinicians going in, and found one of the little guys had pushed open his crib and had crawled across the courtyard and was sitting up on another ledge area of the ETU. And I think he did it just because he wanted company. He just lifted his arms up and I picked him up and started to carry him back to the peds unit. And He was crying inconsolably. He knew he was going to be left there alone. So he, for the most part, was fine. And I had to leave him crying, which is heartbreaking. You don't want to do that to a child.
That's what I'm going to remember, that even though most of them will never care for a patient with Ebola, I hope they took away 2 or 3 little brains that they can use while they're protecting themselves with the C. difficile patient or the patient who has MRSA.
The emergency management world has learned a lot from this, and the way we need to drill, the way we need to practice, and the way we need to teach our staff members. And maybe the panic wouldn't happen if we trained that way.
The military was developing protocols for how to transport infected individuals from West Africa to the United States in the back of a plane. It just sort of struck me that there are these situations that come up that you just can't anticipate.
I don't want anybody to forget about what's happening there, to think it is over, because the struggle is continuing over there. We still need a great deal of resources to deal with this.
I can honestly say that my heart and my head are in Africa.
There's been sort of a trend in healthcare in general, medicine and nursing, toward more and more sophisticated technology. And something like the Ebola outbreak is humbling for the whole profession and for everybody, because it's really back to basics.
The discipline is so worth it. Think of what would happen if we were not here when this happened in the United States. We did have healthcare transmission, but it stopped dead in its tracks. We have so many resources here that other countries don't have. We need to take advantage of that and get as close to zero infections as we can.
When the Ebola situation was happening, it truly was reassuring to know that there were individuals that are in our field that are strong leaders, and you could reach out to ask them, what are you hearing? How are you responding? And Russ is clearly one of those individuals. The CDC, HICPAC, SHE, those organizations that we respect and we trust have reached out to Russ as an individual and as a member of APIC to become a part of their organization.
Dr. Phil Smith, as we entered our first conversations with the State Department about being prepared to perhaps receive patients from Africa, just exuded confidence in our team and handled himself in a way that really allowed the rest of us to feel very confident in ourselves. And as we entered and took care of patients who had Ebola virus disease, he personalized each and every one of them and their family, and really got to know them as an individual. He is able to really just kind of handle himself in this quiet, confident manner, and it just really helps other people be at ease.
Dr. Seaman Yasmin is an impressive individual. She's somebody that has a medical background from England, from Cambridge University, and then joined the very prestigious Epidemic Intelligence Service from the US CDC, the Centers for Disease Control and Prevention. And EIS officers are among the best trained epidemiologists in the world. Seema comes with that background, and now we're building onto that the fact that she's been working as a journalist with the Dallas Morning News, and she was called upon frequently on CNN to really explain to lay audiences the impact of the Ebola epidemic in Africa on the United States and elsewhere.
We really were dealing with a terrifying unknown. And into that unknown came Mike, who had experience taking care of patients with Ebola in Africa. Mike has led many outbreak investigations on behalf of CDC in Africa dealing with Ebola. So, he actually had some experience in taking care of these patients, and was able to bring that experience to bear, but also bring his understanding of the way hospitals in this country deliver care, which is obviously very different from how care is delivered in Africa, and to bring all of that experience to bear to help develop some recommendations that would be practical, would be doable in U.S. hospitals, and recommendations that would help keep our healthcare workers safe.